Muir Wood's very first virtual open house. And this one in particular is for our brand new, shiny new residential dual diagnosis treatment center in Clovis. My name's Pat D'Amico. I'm the CMO, and I'm the one who's been terrorizing you with all the emails. Today, I'm joined by Scott Soul, who's the CEO and founder of Muir Wood. I've known Scott for 10 years. I could tell you he is as good a guy as they get. And I just lost my Zoom screen. We're also here with Tara Kruger, who is our Chief Clinical Officer. And Vanessa Rakis-Garabedian is the Clinical Director down in Clovis. And last but not least is Carrie Figueroa. And Carrie is our Outreach Manager on the ground in Central California, in Clovis and the surrounding areas. And, she's there for absolutely anything you could possibly need. And so I'm, without further ado, I'm going to just hand it over to Scott. Scott, why don't you kick this off and tell everybody about Muir Wood and what's going on.
Thanks, Pat. And thanks for the kind words. My name is Scott Soul. I'm the founder and CEO of Muir Wood Adolescent and Family Services. I just want to thank everybody for taking some time out of your day to join us on this Zoom call. As Pat said, it's our first Zoom call, so I'm sure they'll get better and better as we evolve. And I'm joined by Dr. Tara Kruger, our Chief Clinical Officer here. This is Tara and I. Well, we don't share an office, but there's two offices right here. But we're at our conference room here in Petaluma. And I just want to give you a little background on Muir Wood. There's a lot of friends and colleagues on the Zoom call here as well. Also, I see down in the corner Dr. David Smith. Dr. Dave, founder of the Haight-Ashbury Free Clinics. He's a legend and a very close friend of mine, and is also our chair of addiction medicine. So thanks for joining us, Dave. I really appreciate it. So I started Muir Wood in 2013. We started off as a small 6-bed dual diagnosis residential treatment program for adolescent boys. And we've grown quite a bit. We now are at 76 beds. We've got 58 dual diagnosis beds and 18 beds, primary mental health for girls. We are growing into other metropolitan service areas, MSAs, including Clovis, the Fresno area, where we currently have a 6-bed dual diagnosis residential treatment program for boys. And as of yesterday, we are now licensed for 6-bed dual diagnosis for adolescent girls 12 to 17. Carrie Figueroa, who's on the call with us here, is our outreach representative down in Fresno. And then by November, we're also going to be in Riverside, California, in Southern California, where we have 3 6-bed residential treatment programs down there, 2 for adolescent girls and 1 for adolescent boys. And the reasons that, we chose Fresno and Riverside is because our focus is on serving those markets that are underserved. When I came up to Northern California in 2013, at that time, there were just 2 residential treatment programs up here. One was the camp in Santa Cruz. The other was Thunder Road, which was out of the John Muir hospital system. So, I had co-founded a program in Southern California, always recognizing there was a huge need up here in Northern California. And my family lived up here, and I needed to escape the chaos of Southern California and get up to Northern California. So I came up here in 2013 and started Muir Wood. I think we've grown substantially, but we've stuck to our mission of making exceptional care accessible. And what I mean by that is in 2015, our programs all went in network with insurance. And My goal has always been to create very high quality programs, partnering with highly credentialed clinical teams, but also creating programs in idyllic settings that can be open to as many kids as possible, wherever they fall on the economic spectrum. So our programs are all licensed by DHCS and DSS, Department of Healthcare Services, and Department of Social Services. They're all Joint Commission accredited. And all of our supplemental education programs, our schools, are also WASC accredited, Western Association of Schools and Colleges. We have full-time state of California credentialed teachers, and the boys and girls are all in school Monday through Friday from 9 until noon. We've always tried to create programs here that emphasize kindness and compassion over confrontation and control. And for those of you that have been to our programs, you know that we hire as much for the heart as for the head. And we have not only incredible campuses, but incredible teams. Some of the differentiators with Muir Wood, we are gender separate. So all of our campuses are gender separate programs that spread over 112 acres between Sonoma, Fresno, and Riverside. As I said, they're all duly licensed by DHCS and DSS. And at the time in 2019, when we were certified by DHCS as the only residential treatment program in Northern California certified to do residential detox, we saw that there was a real need for that in Northern California, and I think we're all seeing it now, both in Central and Southern California as well. We also have full-time on-site board-certified psychiatrists or psychiatric nurse practitioners, and we are affiliated with USF for nursing clinical practicum and Dominican University here in San Rafael for practicum for their counseling interns. I'm just really proud of the team that we have here. Again, our mission can be really outlined in 4 words, and it's making exceptional care accessible. We are now in network not only with Anthem in 2015. That's the first payer that we went in network with, but we're in network with Aetna, Cigna, Kaiser, MHN, Magellan, and as of September 2023, Optum, which covers about 1.4 million lives. So I couldn't stress it enough. We try to create a high quality program, but make it accessible to as many kids as possible. In both Clovis and Riverside, we're going to be in network as well. I know that we're planning to have an open house in Riverside in November. If any of you are down south can make that would be fantastic. I know that back in July when we had the open house for our Clovis location, our first Clovis location, we had about 125 people show up to that open house, and it was a great event. I'm hoping that when we have the open house in Riverside, we'll have as many people or more, because it's another stunning campus. I want to introduce someone who I have great respect for, who I stand on the shoulders every day. Again, Dr. Tara Kruger, who's sitting here with me. She's going to tell you a little bit about our program, and then Vanessa's going to talk to you about the clinical program in Clovis. Carrie is going to finish with some descriptions about our program in Clovis, and then I think what we'll do, Pat, is we'll probably open it up for Q&A, which is probably the most best use of our time.
Sure.
Thank you.
Yeah.
Yes, that's quite an introduction, Scott.
Yeah.
Thank you. I'm just so happy to see so many people on this call and interested in hearing about our new location down there in Clovis. I was thinking about this yesterday because I was talking with a new acquaintance outside of work that I just ran into downtown, and she asked what I did, and told her I came, relocated my family down here just a few months ago to come on board with the Muir Wood team. And her response was, "Oh yeah, I know all about Muir Wood. 2 of my nephews graduated the program there. Just said all these wonderful things, and it just has really struck me in my short time here already how connected the community here in Sonoma is with the Muir Wood treatment. And so that is one example of an experience I've had multiple times since coming down here. And I think, what really stands out to us is as we branch out into these other geographical locations, we're hoping that we can reach the same number of lives in Clovis, in Riverside, and really, feel that sense of connection everywhere we go. And I think it really stands out. Those are the things, we're all here for a reason. Those are the things that fill us up and keep us going. And it's, I know that in the short time we've been there in Clovis, Vanessa has been really connected with the community down there. And we've heard, we've gotten a lot of interest and heard a lot of good things. So we're just excited to keep that momentum going and hear your questions and your feedback as well as we continue to develop our service. So I will give you broad strokes overviews of our clinical model. And as Scott said, I think the meat of it will be in the questions. So we'll be here to answer any questions you might have. But in a nutshell, our overarching approach to treatment here at Muir Wood is pretty simple. It's trauma-informed care for dual diagnosis kids that are teenagers struggling with a lot of aspects of their identity. And our goal is to create a safe, welcoming environment that isn't overly formal. They come in, we meet them where they're at, and give them that time to adjust in a physically safe, emotionally safe environment, and then dig into the real work, right? And we do that in several ways, but of course, drawing upon the evidence-based approaches that are out there. So our groups and our treatment are all informed by DBT, CBT, some TFCBT in there, seeking safety, and motivational interviewing kind of being sort of the core group of those evidence-based approaches. And then really valuing the expertise that our clinical team come in with from their unique backgrounds and experiences so that we can work as a team together to bring the best care that's matched to the individual needs of the kid and the family that we're treating here. So one of the other ways in which we do that is we're really leaning into how do we keep teens engaged throughout the programming. And it's really important to keep variety mixed in so that they don't feel like they're doing the same thing day in, day out. So we do that by providing 4 touch points of individual therapy throughout the week. And I'll tell you what that breaks down to. And then a combination of small process groups where there's, maybe no more than 6 to 8 teenagers in their group. And then large process groups with the entire community, up to 18 members in those groups. And then sprinkled in there is also the experiential therapies that they'll do and some opportunities to go offsite and off campus, and of course the family work. So we really try to mix it up, keep them engaged, and a huge emphasis, especially in our dual diagnosis programs, as we have in Clovis, is on personal accountability. And we do that by having a daily accountability group in which they're really encouraged to self-reflect, open up, practice healthy communication skills, and just really be authentic and genuine to who you are. And one of the things that really stands out to me about our Muir Wood team is that's how our team shows up every day for them too. So we come in, we are modeling appropriate self-reflection and accountability, and we're speaking the language that draws upon 12-step principles as well. So we do provide them with the opportunity to connect with 12-step models of treatment. We will take them off-site to 12-step meetings, connect them virtually as needed. On an individual basis, if they're interested in getting connected with a sponsor to aid in their recovery, we will assist with that process as well. And speaking the language of codependency, which really also provides that bridge to what they're doing in their individual work, what they're doing in the family work as well. So Vanessa will be able to speak more to the kind of daily specifics of the group programming and structure down there in Clovis. But as a starting point, when all of our kids come in and start their journey with us, they're assigned to their clinical team. So that will consist of a primary therapist. That therapist does both the individual and the family work for those clients, which I think is a really nice way of making sure that there's no disconnect between what's happening in the individual process and the family process. They will be assigned a recovery counselor that has the drug and alcohol certification and digs into the specifics of their relapse prevention work and triggers to relapse. They're assigned a psychiatrist or mental health nurse practitioner to manage all of their medication needs. And then, of course, we also have our nursing team, our academic staff, and we can't underestimate the value of our care coordinators that are our direct care staff on the floor with those kids day in and day out. And, you know, as I said, we're really trying to just make sure that we provide an integrated approach grounded in those evidence-based models, but with enough flexibility in there that we're able to adapt those approaches to the specific skills of the clinician and the specific needs of the client and the family, because we want to make sure that whatever service we're providing them fits with what they need, what they've maybe tried and done before and found worked or didn't work. We want to take all of that into consideration when developing their individual treatment plan. We're also tracking our clinical outcomes on a regular basis and updating our treatment plans actually weekly, which in my experience is more frequent than a lot of treatment centers do, but we feel it's really important because we want to make sure we're adjusting and tailoring our treatment as we go. We don't have a lot of time with the kids while they're in our residential care, and we want to make sure we're maximizing that. And part of that is also a weekly huddle call with the families. So once a week, they'll have that phone call with the primary therapist and other members of the team as needed to provide those weekly updates on how they're doing towards their treatment goals, what are some barriers we're encountering, and what are we going to adjust accordingly to make sure we're moving in the right direction. So those 4 individual touch points each week come through a minimum of 1 individual therapy session, 1 family therapy session, 1 session with their medication provider, and 1 session with their recovery counselor. And of course, as those of us who work in residential know, there are often many, many other individual touch points throughout the week. But this provides us with keeping our caseload small, provides us with the opportunity to meet the kids individually for those additional services as needed. I do want to talk a little bit more about our family program, and then I'll hand it off to Vanessa to give you some more specifics. But the family care is another huge aspect of what we do here at Muir Wood. And we always say we're not just treating the individual, right? We're treating the whole family. And we really mean it when we say that. That's why we prioritize those weekly calls with the families, weekly therapy, regular updates. And we have a virtual family program that keeps in line with our mission of accessible care, right? So it doesn't matter where the families are coming from, they all have access to our virtual family programming. And that consists of, for current families in the program, they have 2 virtual psychoeducation sessions with Roland Glass, our LCSW, who is an amazing family therapist and really well-versed in the field of addiction and behavioral health for teens. So he does that twice a week virtually, psychoeducation on various topics related to healthy parenting skills, healthy communications, very attachment focused and very emotion focused language and family systems approach that we are working with there, and really connecting that to then how do you bring that and show up in your family therapy session next week. In addition to that, we have a weekly parent support group that parents can join, and that's, you know, we have a clinician there facilitating that, but that's really more led by the parents themselves to reach out to one another, keep their connections going, and really relate and get that comfort and experience in knowing that they're not alone in the process, and hear from parents that are maybe further along in their recovery journey and can share and relate to the challenges that they're experiencing. In addition, we also have a alumni family group that is at no charge to our alumni families. This is also run by Roland Glass, and it's a 16-week parent coaching extension of our family program. And so that's just continued reiteration of those skills they learned throughout the program and applying it now that you're home with your child. How do you keep that go? How do you keep that going? How do we troubleshoot some of those skills and really make sure that we're achieving sustainable recovery? I think that is the main bulk of what I wanted to cover with you all. So I'm going to pass it off to Vanessa, our amazing clinical director there in Clovis, who I just feel every day so grateful that we found Vanessa there to lead our new program opening. She has amazed me at every step of the way, and just being able to hit the ground running and really take these Muir Wood principles to heart and apply it to the team that she's brought on board and developed there. So I'm very happy to introduce you to Vanessa.
Thank you so much, Tara. And thank you so much for your leadership that makes all of this possible. I think one of the things that is so special about Muir Wood is the team, right? And it starts at the top down. So that integrative connection and trust building is not just a thing that we introduce our residents to, it's a thing that we live out each and every day. So thank you for modeling that. So like Tara said, I'm the clinical director here in Clovis. We opened our first house, the boys program, Auberry North, on August 1st, and that's when we welcomed our first resident as well. And it's been such a joy to really be able to build these programs with Muir Wood in my hometown. I can't tell you how special that has been. And I'm excited to see us open our next one by November 1st. So staffing structure for a 6-bed facility, it is very specific to what each and every resident needs. And so we have myself, who's the clinical director, and then a care coordinator manager as the leadership on site. And we lead a team of care coordinators and clinicians that support each resident's program. And typically we have one primary clinician, a recovery counselor, and then 2 care coordinators throughout the day and night. And this allows for each of our residents to have access to the exact level of care they need throughout their day and program. And I really have seen it be the most supportive program I have witnessed. I mean, the residents feel connected each step of the way. They feel like they can ask for help when they need it, and that makes a huge difference in their recovery and well-being. In addition to our care and clinical staff, we also have our nurse practitioner, a psychiatric nurse practitioner, our nurse, a teacher, a chef, and our operations team. And we just all work together really well to ensure a safe and healing environment for our residents. And again, I cannot minimize the power of a team that works well together, because that trickles out to the residents. And so we take that part very seriously. So in terms of therapy and what we offer each resident in service, they participate in at least once a week individual sessions. And this is our opportunity as a clinical team to really drill down to what matters most to this particular team's treatment and what they need to do and what work they need to tackle in order to recover and get to a place that they can actually maintain their well-being outside of this program. Like Tara said, we don't have a lot of time with them. And so we take this session or sessions very seriously throughout the week. They're usually focused on healing from trauma, developing more substantial and adaptive coping skills, and targeting any other underlying mental health issues. So residents also participate in at least one family session per week. And again, we really maximize our time in these sessions because we know that we have them for a short period of time. And so we don't want to waste that, really. You know, we want it to be meaningful. We want it to be powerful. We want it to be transformative. And the family therapy session builds on the work that the families do in the family program. And that's part of what makes this possible. Our recovery counselors also provide addiction-specific treatment, and they support each client in where they are in their addiction issues, and then develop a well-rounded recovery and relapse prevention plan so that when our teams walk out of these facilities, they feel supported, they feel empowered, they feel armed with the skills and the connections that they need to maintain sobriety. So one of the things that makes us really special are the experiential therapies that we support our residents with each and every day and week, especially on the weekends. So we love to try new things and be active. And we also really recognize the power and healing properties of physical activity. So a big part of our program, especially on the weekends, is experiential therapy. We go on hikes in a variety of locations throughout our local mountains. We ride horses, we swim, we do yoga. They also love to play basketball. Our residents also receive personal training tailored not only to each of their physical needs, but also to their psychological needs. And music therapy is soon to be added to our list of experiential therapy throughout the week. I think that for me, this has been a central and integral approach to our program because it strengthens that mind-body connection. And so we can work all day long in an office, but when they're really able to put those skills into practice and live them out every day, that expedites the healing and the transformation that we hope to see with each of our teams. So our typical treatment day or week revolves around this program schedule. And so it begins at 7 a.m. and then ends at bedtime around 10 a.m. or 10 p.m., excuse me. And while we have a really well thought out and well planned schedule, it's also the moments in between each scheduled activity that help to create what is so special about Muir Wood. Our programs focus on creating a strong sense of connection and trust for each resident, and that becomes the foundation for the healing work they do while they're with us. So we have blocks, and I think that we can share a sample schedule with you. It's also available on the website. So we have blocks of treatment throughout the day. They have a 3-hour block of academics, and then they have several hours of group therapy. But in between those, they are in transition, and they are supported by our staff throughout all of those program activities. And that is part of what keeps them connected. That's part of what allows them to build their skills. And that foundation is really what allows them to be successful in their treatment goals. In addition to our academics, they do their group programming, which can range from DBT to CBT to seeking safety, and then also recovery support and relapse prevention. And then recreational therapy, like I said, has a big place in our programming, and it really, I don't know of a day that we don't do recreational therapy. It's central to what we do here. And it gives, like I said, it gives the teens really a chance to connect to who they are. And that's pretty special to watch. So I think that's it for now. And I'm going to pass it back to Scott to hear more about our academic programming.
I'm actually seeing a question in the chat
Oh,
from Sarah about
yeah.
discharge planning. Thank you for asking that, Sarah, because I did not touch on that. And that's, of course, critical to the residential experience. So we do start discharge planning practically from day one. Really, our goal is by the end of the first week to have a pretty clear recommendation at that point in time. First and foremost, if we're recommending an outpatient experience following their completion of residential with us, or if we think we're looking at more of a long-term need, such as a therapeutic boarding school or other long-term program. So we at least aim to have clarity on the basic recommendation by the end of that first week. And then we're just going to kind of treat it as an ongoing process, right? So we'll assist with providing referrals to local IOP or PHP programs in their area. That is by far our most common step down aftercare plan, is to go to that level of care. And we are working closely with the family, with the clinical team, to just communicate as treatment evolves regarding the specifics of what that care might look like, right? So if we think they need a DBT focused program from a more formalized DBT approach, that might be something that we look at and really help them dig into it. But we're really also approaching the process from a point of empowerment, where we want to provide parents and clients with the tools to ask the right questions, be curious, integrate that with what you're learning about yourself throughout the treatment process and learning about your family, so that we can help you find the best fit. We have in Sonoma County recently added a position of clinical case manager to assist with the discharge planning process. And so he is also available for more complex situations, or we're struggling to identify an accessible program for these clients. Then he gets involved and helps assist with any recommendations we can. And Carrie and her outreach team also are heavily involved in that. We want to make sure we're providing as many resources as possible. I also want to mention that we're frequently finding that our clients have a need for some additional psychological testing to clarify their diagnosis or neuropsychological cognitive needs for support. So while we're not able to provide that in-house, we're always considering whether or not that would be helpful in identifying their needs. We work with a network of psychologists that are able to sometimes come in while they're in residential care and provide quick turnaround on that assessment process, so that we can use that to guide the aftercare recommendation as well. And then we do always send our families home with a home agreement. So those last couple family sessions are really focused on summarizing everything they've learned, what's in their relapse prevention plan, what's in their safety plan, making sure everyone is on board with that commitment to not only what the aftercare next steps will be, but how is our communication going to be different? How are we going to manage slips and recovery? How are we going to talk about that? Mom and dad, what are the words that I want you to say to me when you're worried about me versus, what are the words I definitely don't want you to say because I'm going to respond the same way I did defensively prior to coming to treatment, right? And putting it out on paper so that they have that to look back on and reference once they're home.
Thank you.
Absolutely. And now I'll hand it back to Scott. Sorry,
Yeah.
I jumped right in there.
Well, I am amazed every day with Vanessa and with Tara, and in Riverside, Jessica Mon is going to be our clinical director down there. Jess kind of came up through the farm leagues with us as an intern. She's an exceptional clinician. She's now a licensed therapist and has been for some time, but she has volunteered to move down to Southern California to start our Riverside program. So we have an exceptional team, as you can tell. Yeah, I mean, Carrie, do you want to say a few words so people can get to understand your role down there in Clovis?
Yeah, absolutely. So I'm Carrie Figueroa. I'm the outreach manager for the Central Valley. Born and raised in the Central Valley, so having a program like Muir Wood in my backyard is absolutely amazing. I couldn't be happier to be representing Muir Wood here. I've been working primarily with adolescents and their families here since 2020. And I am always happy to connect, always happy to talk treatment, happy to help families connect with the right program, regardless of where that ends up being. I really just want to be able to be a resource for the Central Valley and making sure that everybody gets the care that they need and they deserve. My contact information is in the chat. I'll put my phone number in there again before this is over. And if you don't catch it, you can always find my info on our website. I know my email's on there, but really feel free to reach out anytime, 24 hours a day, weekends. I'll always take your call.
Thank you, Carrie. Hey, seeing in light of the fact that we're also going into Riverside soon, I just want to quickly introduce our outreach manager in SoCal, Howard Mattiong. And Howard's you'll probably all know Howard. Howard is an ace of a guy. Howard, why don't you say hello and let everyone know how they can get in touch with you as well.
I'm Howard Mattiong. Like what Scott said, I worked with him back at Daniel Freeman, and we had several stops along the way. And when this opportunity came up, I just couldn't turn it down. It's just a wonderful opportunity. I just hear great things, even before I started working. The good work that Muir Wood does, and I'm ready to make an impact in the Inland Empire in Southern California. So I will put my information in the chat. I'm available, just like Carrie, to take your call, help your families navigate this behavioral health space. I want them to make sure they're not Googling any treatment programs, and I could be that last stop for them to make sure their teenager and the families find some peace of mind.
We have a handful of good questions that we are going to answer. Before we do that, I'm going to share my screen and take you on a little 3-minute virtual tour of the new Auberry facility so you can see what that looks like inside. And let's see if this will actually work.
would the Clovis and Riverside people talk about the severity of dependence and the changing nature of the problem you're seeing before we run out of time?
Thanks, Doc.
Yeah, I mean, I can tackle that, but Vanessa might be better. I mean, so again, back in 2018, when I was working with the Department of Healthcare Services up here in Northern California to become the only residential program certified to do adolescent detox, they had to literally create a new certification for us. And so at that time, we were the only certified program up here in Northern California. And I did that primarily because, you know, we were seeing more and more younger kids come in, not only with higher psychiatric acuity, but much more substance use disorder acuity, specifically with opiates. What we're seeing now is, obviously, is the wave of fentanyl. And what's most scary to me is that for a lot of the kids that we're seeing and we're treating here, typically it's their first drug of choice, where it used to be high potency cannabis, and then there was that continuum. We're seeing kids who are self-medicating with fentanyl, and you know, one of the, you know, we have overdose emergency kits all throughout all of our facilities, which is something you didn't see a couple of years ago. We're lucky in that all of our programs have 2 full-time nurses. We have, again, full-time psychiatry, and we're lucky to have Dr. David Smith as our chair of addiction medicine, and also our chair of medical quality assurance, which meets every quarter. But yeah, we're just the level of acuity that we're seeing these days with the kids, as Dave said, it's not just a teen mental health crisis, but the level of substance abuse is in my 36 years of working with kids and families, this is by far the worst I've ever seen it.
Thank you, Scott. And originally I wanted to respond to that. Leading cause of death in this population now is drug overdose. The question, and I know what a superb job you've done, what I call Muir Wood Central. What about, does Clovis and Riverside have the same level of detox? Do they have Narcan on site? I'd really like to hear that, because as you know, what we're trying to do through medical quality assurance is have Muir Wood treatment protocols that are the gold standard in the field. And I just wanted to hear whether that gold standard in the medical area.
That?
Yeah, but have you seen the fentanyl in Fresno and Clovis? And that's basically what I'm leading to.
I would say absolutely the fentanyl crisis is here in the Central Valley, 100%.
Yep. Yes. Yeah, I mean, we're definitely treating it here, and it is front and center of all of the education that we do with our clinicians, with our staff, with our medical staff. And yes, we have the same level of treatment and response available here as we do in Sonoma County. So we are able to support it and make sure we're doing what we need to do for the kiddos.
Yeah, and then, you know, just for everyone's edification as well, I mean, I was reading some data last night, looking at some charts, and in Riverside, for example, it's one of the highest per 100,000. It's one of the highest rates of adolescent overdose of any county in Southern California. But that being said, the ability for treatment access is one of the lowest. So if you were to go on to the Department of Social Services and look at the number of group homes, which is how we're licensed, in Riverside, there's a total of 10. And only 5 of those are similarly licensed as Muir Wood to treat substance use disorder. So the access points in Riverside and the access points in Fresno County are extremely low. You know, Los Angeles County, Orange County, you literally have dozens and dozens of access points for kids and families. And that's particularly why, you know, I've chosen to focus on underserved communities, because that's really where the help is needed the most.
John is asking, if we accept TRICARE, what are our rule outs, and do we work with Indian Health Services?
So we don't work with any health services. We're in current negotiations with TRICARE. And John, as you probably know, I know you've got a lot of experience here. Working with those, working with TRICARE is difficult, and so we're kind of going back and forth. And we've been doing that for about 9 months now. For exclusionary criteria,
I can take that
you want to take that one?
Yeah. I'll probably miss a couple things here. So ask if you have questions. We try really hard to give every kid a chance here that we can. So I just want to say that starting right off. So I feel like our bucket of black and white exclusionary criteria might be a little bit smaller than some other treatment centers, and we do that intentionally. So our more black and white exclusionary criteria would be a history of violent aggression or violent crimes, physical aggression towards others, which we typically look at if it's been limited physical aggression towards one particular family member, which we see more commonly. That's not necessarily exclusionary in and of itself. It's more if it extends towards others outside the family or outside the home. We require a minimum IQ of 80, and we're going to be looking at, daily functioning so that they can take care of their own ADLs and hygiene, basics. Of course, basics for a teenager, right? And we do not treat primary ED, so that would be a rule out. We cannot take the primary eating disorder. If there is eating disorder behaviors and symptoms, we're going to take a look at that and see if, from what we can tell at the pre-admissions standpoint, if they're reasonably able to sustain nourishment and medical safety while they're in our program. Rule out would be psychosis that's not currently managed by medication. And a history of fire starting, animal cruelty. Really what we're talking about, if it's a primary conduct disorder diagnosis and there is no identified other mental health symptoms accompanying that, that's really not what our treatment program is designed to be. We don't take a primarily behavioral approach to treatment. So we need kids that are going to be able to engage with the community and in an insight-based therapeutic program here. I'm taking a look at a couple notes to see. I think those are the main ones. And then, of course, if there's a history of sexual predatory behaviors, we're going to take a close look at that to make sure we can ensure the safety of our milieu as well.
Scott, here's a law enforcement question. What types of law enforcement response do we have at the other facilities? Do you have clinicians able to place mental health holds, or is that an expectation of law enforcement? I would like to prepare our area deputies. And by the way, this is Jason, who's a Fresno Sheriff's Office deputy. I'd like to prepare our area deputies with types of service calls from Muir Wood and be prepared for that.
Yeah, so currently up here in Northern California in Sonoma County, we're working with the county right now to get our therapists designated to write holds, which is something that for group homes they haven't done in the past. But to understand the level of care that's just above us would be an acute care medical center with a psychiatric unit or a psychiatric hospital, and then those kids are being discharged where those kids used to be in the hospital for 14 to 20 days. We're unfortunately seeing those kids now on the 4th day of a 72-hour hold. And so again, the landscape has changed quite a bit. So the county is working with us to get our clinicians designated to write those holds. We do have a really good relationship with law enforcement here in Sonoma County. They're very supportive of us. They understand that we're providing, a very needed service. When we had our open house in Clovis, our physical open house, we had law enforcement show up to the open house. Again, with the hopes of working collaboratively with them. One of the things that the deputy did mention to me when I was at the open house in Clovis is that there's really 2 deputies serving a very large area in Fresno. So unlike Sonoma County, there's just not that support available to us. But again, we work collaboratively with law enforcement, and we hope to do that in Clovis and in Riverside as well. And I know in Riverside, we've already had town forums with both the parents and law enforcement down there. Again, I think they understand that we're meeting a need in the community, and our hope is to work collaboratively wherever we go.
Mr. Gillivery would like to know how long is the program?
Well, since we're 98% of the kids we see are coming in network, it really depends on the medical necessity of each kid that we see. Depends on the case manager at the pair that we're working with. Some pairs obviously authorize longer lengths of stay, but on average, we're probably seeing around 45 days.
That pretty much wraps it up. If you have any questions, just speak up. Otherwise, we're going to wrap it up. My email address is right here in my screen up there. If you would like to receive a brochure, a cheat sheet on the programs, on the locations, our in-network contracts, I can send you absolutely anything you might like to have. Just drop me an email, and I'll also make this the recording of this open house available to you, so that you might be able to share it with others. And we'll also share it with the registrants who were not able to make it. But I just want to say thank you very, very much for joining us today, and keep your eyes peeled for the invitation to the actual in-person open house in Riverside. We throw a great party for you.
And then also, we'll be having the open house for Auberry South, which will be the 6-bed residential dual program in Clovis, which was just licensed yesterday. We'll probably be having that open house sometime before year's end. And, both Tara and I will most likely be there. So anybody that we haven't met in person, we look forward to meeting in person.
I'm seeing a few other questions that maybe we didn't get to, so I'm happy to stay on for a couple minutes for anyone that has lingering questions, or you can shoot me an email anytime.
I have a question, if you don't mind me asking it. It would kind of take a bit to explain in the chat, but that house is beautiful, by the way. And I was just wondering, how does it work with the detox part of it, or sometimes like the suicidal behaviors that may come through that detox? How does that work in the house with you guys?
In terms of suicidal behaviors while they're in the detox process itself, is that what you're?
Yes, or just sometimes I've had friends that have detoxed, and sometimes it can be just like all the medical pieces that go, is that because you have the nurse there, like you have all of that in house, or do you ever have to move them to the hospital to complete any of those pieces, or is this like fully in house?
Yeah, it's a great question. Typically we're doing the best we can prior to admission to see if we think we would need a medical clearance prior to arriving on site.
Okay.
If that's the case, we would recommend they first get that medical clearance on their way to us. Of course, It's a perfect process and you don't know. So there's maybe been a handful of times that just out of caution, we're taking them to the hospital to get checked out. But I would say most of the time, we are able to medically manage those symptoms, and we, adjust our programming as needed depending on the level of detox and MAT treatment that's being provided, especially in those first few days, really for any of our kids, regardless of detox or not. We understand that they may need some more individual time, attention, time away from the group. We again, just need to be able to support them in any way we can.
And again, our programs have full-time nurses, so we have the ability to kind of split the nurses off and do one-on-ones if necessary. But I mean, safety is paramount. Safety is the top priority with all our kids. And we've, knock on wood, we've never had a sentinel event in the almost 11 years we've been in business. We've never really had, medical complication. And I think it's really because of the work that the admissions team does on the front end, and then the people like Dr. Smith and our nurses while our kids are going through treatment.
Mm-hmm. And we do, of course, upon arrival, we do drug screens. If there's a concern for a brand new client that they're under the influence, we may also first take them to the emergency room for clearance, just because we don't know if they're actively intoxicated. We want to make sure from a safety perspective that that is something we feel comfortable admitting to. I did see a question somewhere in there about PROACT, and that is something we've actually had a lot of active discussions about, is getting all of our staff PROACT trained. So that's to come very soon. And of course, as a base level of education for all of our staff, we teach verbal de-escalation techniques. And from a clinical standpoint, all this discussion about risk management, we are routinely, for all new admissions and routinely throughout treatment, using the Columbia Suicide Severity Scale and Safety Protocol to guide our assessments of safety from a suicidal perspective. And we do encourage our clients, whenever possible, to engage heavily in that safety planning process, because we want to avoid hospitalization whenever we can. And the next best thing from there would be for them to voluntarily go to the hospital for assessment, since we are not able to write those holds ourselves currently. And then we have a full assessment that we can communicate and collaborate with the care team at the hospital to get our guidance on what we're seeing.
Thank you. So I have a question now. I did the PROACT question. I taught that for years, and that eliminates a lot of law enforcement coming if you just take care of it yourself, and it doesn't re-traumatize the child. I work in Stockton, downtown. We need treatment up here. Have you thought about coming up here?
Yes.
And will you ever make any exceptions or work out where you can? 90% of my patients that I see here, children as well as adults, are all Medi-Cal, San Joaquin Health Plan. Are you ever going to have scholarships or something like that so we can help some of those underserved?
Well, we do have a scholarship at Muir Wood. It's called the Jennifer Golick Scholarship, and so we do have a scholarship, and we encourage families who can't afford treatment to apply. And in regards to coming to Stockton, it is definitely an MSA we've been looking at. It's another highly underserved market.
You'd have no idea. I work in the emergency room. I see it every day.
I have a question. I work primarily with kiddos with suicide ideation, past attempts have been on holds. Now, would this be a good placement for a kiddo that is actively suicidal or is experiencing suicide ideation?
That's a great question. So I think our distinguishing factor at the point of admission is if they are actively suicidal with some level of intent and plan, then we would not be the right stop for them. We would recommend they be assessed for a 5150 hold. However, we see a great deal of our clients have a history of chronic SI, multiple suicide attempts in the past. So, as long as they're able to safety plan with us, then we are the right place for them.
That's helpful. Thank you.
You're welcome.
Anyone else? Great. Thank you so much, everyone. And it was great to meet you, and we'll look forward to being in touch. Need anything at all? Carrie Figueroa in the Central Valley, Howard down south, and we'll look forward to talking to you again.
Great group of people. Thank you, everyone, for what you do.